Okay, first thing I'm going to do is check the patient's chart and make sure I have all the correct medications.
Come in.
Hello, Mr. Foster. My name is Kate and I'm with Respiratory. Is it okay if I could go ahead? Today the doctor has prescribed 3 different medications for you to take. One is Brovana and it's a long-acting adrenergic B2 agonist, bronchodilator. The other one is Spiriva and it's a long-acting anticholinergic bronchodilator and it's a maintenance inhaler. And then the third one is Qvar and that's going to be a corticosteroid meter dose inhaler. Okay?
Okay.
Is it okay if I take a listen to your lungs? Yeah, okay, great, thanks. And I'm sorry, before I get started, can you go ahead and tell me your date and your name and your date of birth?
Oster Foster.
Uh-huh.
And June 1st.
Great, thank you, Mr. Foster. All right, I'm going to go ahead and take a listen to your lungs. Go ahead and take a deep breath. Another. Another. And another. And can I have you sit up straight? I'm going to listen to your lungs here. Take a deep breath. Another. Another. And one more. Very good. All right. I'm going to check your vitals here. Go ahead and okay, thank you, Mr. Foster. I'm just going to record your heart rate and your respirations here. Okay, so the first medication that the doctor prescribed for you today is Brovana, okay? It's a long-acting beta-2 agonist bronchodilator, all right? And have you ever used one of these before?
No.
Okay, you're going to take this one, you're going to take this treatment 2 times a day. It lasts about 12 hours. It starts to get to work within 15 minutes and its peak is from 30 to 60 minutes, all right? But because it only lasts 12 hours, we're gonna go ahead and take this twice a day, all right? And at home, I'll go ahead and explain to you. Let me hook this up here first. It's gonna start to mist. Go ahead and hold that upright, put your lips around it there and just breathe normally. Take some deep breaths every now and then, hold it in, and now just continue to breathe normal. It lasts about 8 to 10 minutes and you can tell at home when it's done, it's gonna start sputtering, okay? And then you'll know the medication's done. But also it only lasts about 8 to 10 minutes, all right? So when you're done with the treatment here, you're gonna wanna make sure that you're gonna wash it. So you gotta take everything apart. You're gonna wash it with cool or warm soap water and then you're just gonna let it air dry on a paper towel here, okay? Take out all these pieces. And you can just let it sit there. This will come off as well. There you go. You can let it sit after a warm soapy bath and rinse it with warm water. All right? Okay, the side effects to that though are an increased heart rate, shakiness, and a headache. And if they get really severe, if you have some severe side effects with that, if you feel like some heart palpitations or you feel like you just can't breathe, you want to go ahead and go to the hospital, okay? All right. The second medication I have for you today, oh, and can you go ahead and just give a cough for me? Very good. All right. The second medication I have is Spiriva. It's a long-acting anticholinergic bronchodilator. It relaxes the smooth muscles and lining of the airways, same as the bronchodilator. Just uses a different mechanism to do that, okay? So with this one, we're gonna use a dry powder inhalant here. And what it has in here is just a little blister pack. So you just go ahead and click it once and it'll pop that pack open. It's a dry powder. So the key to this though at home is you don't wanna breathe into it because any moisture in here is gonna make that medicine all clumpy and it won't get down into your airways, all right? So first thing you need to do is go ahead and exhale. And go ahead and inhale. Get it down into your lungs. Hold it for about 5 seconds. 1, 2, 3, 4, 5, and go ahead and exhale. Very good. All right, and that you only have to do once a day, all right? It has 18 micrograms per inhalation of medicine inside of it, so there you go. The side effects with this, though, is definitely dry mouth or some nasal congestion, all right? So just be aware of that. It takes about 30 minutes to work, and it peaks at about 1 to 3 hours, all right? And it lasts for 24 hours, so just once a day we need to use that here. All right, and now the last medication that we have is Qvar. It's a a metered dose inhaler, and it's used for inflammation, okay? It's a corticosteroid. So there's a couple things with this that we will want to do. We definitely want to use it with a spacer here, okay? And that's going to help it get down into your lungs and not sediment into your mouth at all here. So we want to prevent things like thrush happening in your mouth. So with steroids, you just have to be careful with some of the different side effects. Headache, nausea, vomiting, any of those things get really severe, we'll definitely want to go to the hospital, okay? All right, so first thing, you're going to want to shake it up really good. Go ahead and stick it into your spacer here, all right? And you can just make that, it has a nice little mouthpiece there. You can secure it around your mouth and nose. And all you're gonna do is just give one little press to the button here and inhale. Very good. Now hold it for 5 seconds. 1, 2, 3, 4, 5, and go ahead and exhale. Can you give me a nice cough with that? Very good. And I'm gonna have you, after every time you take the corticosteroid, go ahead and rinse out with some water. Don't drink it, just put it in your mouth, rinse it out, and spit it out, okay? And that's gonna prevent a lot of things like hoarseness, a sore throat, and definitely fungal infections in your mouth like thrush, all right? What else do we have? So that lasts about 12 hours, so we're gonna go ahead and do that twice a day as well, all right? Do you have any questions for me?
No.
Okay, can I go ahead and take a listen to your lungs again?
Sure.
All right, thanks. Okay, take a nice deep breath. Nice deep breath. Another. Another. Okay, up for me. Okay, another deep breath. Another. One more. And another. Very good. All right, let me go ahead and check your vitals as well before I go. All right, I'm just gonna record that real quick. All right, thank you, Mr. Foster, for your time. You sure you don't have any questions for me?
No.
Okay. Real quick, I want to make sure I went over cleaning the maintenance inhaler of the Brovana, not the inhaler, but the nebulizer of the Brovana. And then with these, you want to store in a cool, dry place. Okay. All right. Thank you for your time.